So I think the things that women need to know about over the age of 35 when they're trying to conceive is that, even though they may feel very young, and really 35 is very young, reproductively speaking, however, it's a time where different women can have different egg numbers, and some women at 35 don't have problems conceiving, but some women can have a really difficult challenge. And so I think the key point to know is that time is kind of limited, and so they need to be pretty proactive in terms of trying to figure out what the problems are and also be proactive in really the treatment that we give. So some of the challenges that women may have when they're trying to conceive over 35 would be that, first of all, it's more difficult to conceive for many women. Also, when women actually conceive, they have a higher risk of miscarriage. And then, if you also have a partner that may have some challenges, it may make it even more difficult for you to get pregnant. When someone comes to see me over the age of 35, I really want to do diagnostic testing on them, because I think it's really important to know sooner rather than later what the issues are. So the things that we would think about doing would be, we do an evaluation of your fallopian tubes. We would look at your partner, make sure his sperm count was okay, and then we would do some sort of testing on your egg number to figure out kind of what your egg number was and kind of what your fertility potential was based on that number. I think if you've had testing done at your OB/GYN's office, that's perfectly fine. In fact, in some ways that may speed things up a little bit. Kind of at that point, once we have all the information, then we can kind of decide, how we want to pursue treatment. And I think one of the things that is a little different about somebody over 35 versus somebody that's a little bit younger is we can still go through some of the same treatments, but we just may want to do it more quickly and kind of get to more aggressive therapy as quick as we can. Some of the treatments for women over 35 would include treatment with oral medication for the female patient. For the partner, we would use his sperm and do inseminations. We can be a little bit more aggressive for the female partner if we move on to injectable drugs, also with insemination. And really the third option, and really the most aggressive option, and also the most successful option, would be in vitro fertilization, where we take the female partner's eggs, we put them with sperm, we create embryos. We're able to genetically test those embryos, and in doing so, if we have a genetically normal embryo, we have a much higher success rate for women, and we can do it very quickly.